Miss Lisa Adams. She's the Associate Principal Sustainability Champion from HKS. Miss Lisa serves as Interior Design Director for the HKS Chicago office. Adams' work in Chicago includes interior design for the Medline Industries corporate headquarters. She has over than 18 years of experience, and her evidence-based design approach achieves optimum performance and best return on investment. Ms. Lisa was on our project, managing our project as interior design for the North Tower Al Musa project that will be launched or initiated soon. She is working also to introduce a healing environment and that impacts positively the patient experience. Ms. Lisa has won the American Institute of Architect Award and HKS Volunteer Award. We welcome you, our dear architect, and may you have a pleasant day ahead.
Hello, good morning. Salam. Has everybody gotten their coffee? Thanks for showing up for the first presentation. I'm very excited to be here today to speak with all of you as exceptionally talented medical professionals. I myself am not a medical professional, I'm an interior designer, but I've been spending the last 20 years thinking about how spaces can have an impact on improving the human experience. So we'll talk a little bit more about that today. So when we talk about healing environments, what do we think of first? Usually, what I think of are all of you, exceptionally talented and passionate medical professionals, spending day to day advancing the patient condition. I also think of science and all of the technologies that have been made available, improvements in procedures to help patients heal faster and stay well longer. But there's a lot of evidence that also points to other factors beyond just medicine that helps people to stay healthy. Our communities, people that we love, that surround us every day, both in our families and in our cities at large, are part of that healing experience, as well as spaces. The decisions that we make in designing these environments can help or hinder the patient experience and human well-being. In 1984, Dr. Roger Ulrich did a study. He took hundreds of patients post-surgery and put them in one of two categories. Category one, the patient had a view looking out the window onto an adjacent building, essentially a brick wall, not too much of a view. The second half of the patients were put into rooms that had a view of an exterior landscape, a nice natural environment. Now, it's not surprising for any one of us, we would certainly prefer to be in the second room, right? But it's more than just those preferences that this study began to investigate. What we started to find out was that had an impact on patient outcomes. Not only did it reduce fear and anxiety levels, but it also reduced the amount of pain medication that those patients needed to take. It also reduced post-surgery complications and even reduced the hospital stay. So why was that? Has anybody heard of the term biophilia? What biophilia means is, according to biologist E.O. Wilson, it's an innate and genetically determined affinity of human beings with the natural world. So, a few examples that you're seeing up on the screen here. It could be something simple as the introduction of filtered light, the use of natural materials in our environments, the sense of knowing where you're going, having an intuitive sense of wayfinding, clear sense of direction. We call that prospect and refuge. And what that really means is, as you look at a landscape in our DNA throughout the evolutionary process, there are certain landscapes that are preferential to us, landscapes that have an open, horizon line, where you can see your path of travel very clearly. Landscapes that offer some element of vegetation, life-sustaining materials, those are also preferred elements, as well as environments that give you a sense of choice. Maybe in an open scale environment, you can seek out refuge somewhere to maintain a sense of safety and comfort. This is how some of those ideas might translate into a built environment. We don't live in the outdoors anymore, but we still benefit from having some of those biophilic properties in the interior spaces. And that's what biomimicry is. So you're seeing here some of the same principles of filtered light, the use of natural materials that are comfortable and familiar to us, intuitive wayfinding, how we might design in paths of circulation that are immediately visually available so we know how to navigate ourselves to our next destination. And then offering that sense of prospect and refuge, especially in public spaces that can be very overwhelming. It's so important that we assure our visitors and our patients that they have an easy way of navigating their way through the space, and that we also give them spaces where they can take refuge and have a moment of pause in states of duress. So these concepts, these terminologies might be new, but these concepts are not new. In fact, throughout the centuries, we've seen both successes and failures in the use of biophilic properties in built environments. For example, in 4th century Greece, the Asclepion was built on a site with a natural sacred spring. Now they did this, one, to use the water of the sacred spring in the healing processes. Patients were bathed using that healing water, but they also felt that it had healing properties for the soul as well. If you were to look at the floor plan, you would see that most of the patient spaces are in an eastward facing orientation. Now this is to take advantage of circadian rhythms. We know that circadian rhythms help to put our bodies in better balance so that we're able to recover and heal more effectively. Now moving along, we have some missteps as well, some setbacks. Looking in the 16th century, a typical European hospital wasn't necessarily a very happy space to be in. These are very confined environments, no access to natural daylight really, very little, very poor ventilation. In fact, if you found yourself in one of these spaces, you're probably in pretty bad shape. You were either dying of the plague, or perhaps you were impoverished and just didn't have any other alternative somewhere to go. But moving ahead, if we were looking at London in the mid-1800s, we started to return to think about biophilic properties and how they could benefit the patient experience in the built environment. And so if you're looking at that floor plan, you'll see a series of fingers coming down on that plan. Those are the patient wards. Why are they so skinny in their footprint? They are so that all of the patients inside of those spaces have access to natural daylight and natural ventilation. In fact, Florence Nightingale was in this period, and in addition to that, she felt that the role of family and community was also essential to the healing process. Now, fast forward ahead to what we would call modern times, starting in the 1950s, our patient care spaces tended to have much more clinical focus. It was less on the biophilic properties, it was less on patient and family, and it was more on the advances in medicine. We did start to see some focus on not patient wards, but semi-private rooms, but without having our families around us, that wasn't necessarily lending to the best patient experience. We know that having those families available and accessible and part of patient care leads to much better patient outcomes. But in addition to our own nuclear families, our communities are a support structure as well and familiar to us. So as we're designing architectural spaces, especially hospital spaces, it's very important that we're thinking about how we design in those features that extend that invitation of hospitality and welcome in our medical environments. In addition to that, the professional community also needs to be thought of. We know that our medical professionals have a very rigorous schedule and work in very stressful conditions. And so more than just designing spaces to enhance the patient experience, we also need to be thinking about designing spaces to enhance caregiver experience as well. I want you to put yourselves in the shoes of being a patient and arriving at a hospital building. I'm sure that you've all been there at least once or have been with a loved one in this kind of an experience. It's extremely stressful. You might have traveled a very long distance to get to where you're going. And arriving at a campus and seeing a building like this might be a very beautiful building, but where's our sense of entry? Do we have any kind of an idea of what might be going on inside of this building once we get through the front door? Is there any sort of an element of hospitality on the exterior landscaping that extends an invitation that this is a friendly environment? No, not necessarily. And after we've made our way into the interior spaces, again, this isn't necessarily an unattractive lobby space, but think about those ideas of prospect and refuge as you're looking at this image. 3 key questions any patient wants to know when they walk into a building is, where am I going? How do I get there? And is there a way I can seek refuge or just have a moment of respite to myself to help me get myself back together before I move on to where I go next? So looking at some of these public spaces, oftentimes by adding decoration, we do more harm than good. We create visual clutter that becomes a distraction, taking away from those intuitive moments of wayfinding. We took a lot of these concepts to heart as we started to design the new hospital for Al-Musa. So what we're looking at here is the ground floor plan. There in the center of the plan, with the number 1, that is our main point of entry into the hospital building. So you would have a drop-off immediately in front. Patients, visitors would be able to be ushered inside. And then for the rest of the floor plan, what you're seeing are 2 different choices of environment. To the right, you would have our atrium lobby space. That's where you can seek information about where you need to go next. That's also where you would find the vertical circulation, which is a fancy word for elevators, to get you to the floors above. But to the left, all of that is amenity spaces. Now, in most hospitals, we might think about that as a programmatic element that maybe we would put in the basement or somewhere off of the front door of the building. But we chose not to do that for a very good reason, and that's to extend that message of hospitality and welcome to our patients, to the community at large. So we've made our way into the hospital through that main vestibule, and what you'll notice is when you come through that second set of doors in the entry vestibule, it doesn't necessarily release you into a large volume of space. Instead, what it does is it introduces you to a piece of artwork. It's a 3-dimensional element that is a replication of the cedar tree, which is the Al-Musa logo. So what that's doing is it's offering the users a moment of pause as they collect themselves as they're coming into this environment. They know that they have choices to their left, they know they have choices to the right. And what we're seeing here is if you were to go to the right, there's our information desk where you can get those questions answered. Where am I going? How do I need to get to where I need to be? You also have a few moments of refuge that you can have a seat and make yourself comfortable before you get there. Now, if I were to make the decision to turn to the left, maybe I've come early. I just want to be able to get some refreshment, a cup of coffee. What a nice feature to be offered after perhaps a long journey to get here. So there's a series of different amenity spaces that we're offering here. In the foreground, you're seeing a cafe element. In the blue, you're seeing healthy grocery. Up to the top margins of the plan, in the pink is a retail gift shop. And in the blue, you're seeing the retail, an extended portion of the retail and retail pharmacy. These spaces are designed not only for patients and family members, but we also took to heart all of the caregivers and giving them the availability to use these amenity spaces. We also thought about the fact that when you come into the building, you're already seeing these spaces even before you get inside. So the whole front wall of the building is a 3-story glass wall that as you're making your approach into the building, you can see some of these amenities and start to set aside some of those fears of what's next up on deck to come. Remember the qualities of filtered light, biophilic properties? This is how we utilize them in our main public realm spaces. So you're seeing a wood screening structure that helps to provide filtered light, as well as the inclusion of vertical gardens that offer those biophilic properties that even though it's a large space, it evokes a sense of calm. That screen wall actually turns to the next elevation within the hospital lobby. There, what you're seeing in the background is a rough cut stone wall that is a water feature, so it would have water grazing that surface. And to the left of that, the large wooden square-shaped box that you're seeing, those are our elevators, what I call vertical circulation. Now, we could have just said that's a white painted wall, maybe put some artwork on it, but there's a reason why we highlighted that form as an experience, and that's because we wanted that shape to stack all of the floors above in the building so that people had that innate sense of familiarity that whenever they saw that wood-clad structure, they would know that that was a venue to go to get to the floors above and below. Also, if you're looking at the second story, those are our clinic spaces, highly populated, receiving heavy volumes of traffic every day. So there's a reason why we created a balcony here so that people from the clinic could look down onto this lobby space. And if you were in the lobby space, you might already start to see, oh, okay, that's where I'm going next. When we talk about refuge, so here we have images, large-scale environment, prospect. Very easy to see where you're going. Left-hand image, refuge. That screening wall that you're seeing towards the back of the space actually sits forward in the plan. So you've got maybe a couple of meters of space where we've tucked in more private moments so that people have that element of choice to have a more private moment of pause if that's what they feel they need. So let's pretend that we've made our way into that elevator core and we're going to go upstairs to the clinics above. I've got an example of an elevator vestibule here, and you might be asking yourselves why I would spend any length of time talking about such a tiny space like an elevator vestibule. But it's important because this is inevitably a moment of pause where a patient is waiting for 30 seconds, a minute, 2 minutes, and thoughts are probably turning in their head. Being able to offer biophilic properties like qualities of filter light or an artwork installation, we call that a positive distraction to help the patient to be able to refocus on positive thoughts rather than on fear and anxiety. So I'm using this as an example. These are waiting rooms. I'm sure that we've all been in these spaces. I know I've been in these spaces. And it might be the easy thing to say, well, we've got a waiting area, let's just pack in as many chairs as we can. But maybe we need to give some more thought to how we organize these waiting areas. I call this the bus station effect. So here you are in a chair, staring at everybody else in the room that's also very anxious about their appointment, and we're all sharing in each other's anxiety. You may have natural daylight, you may have plant elements or artwork hanging in these spaces, but there are better ways to afford our patients with a more considerate waiting experience. This is a view of our clinic waiting area. It's a very large space. We actually have 3 different disciplines. That's why you're seeing 3 different check-in desks. And this space needs to take on a high volume of people moving in and out. First thing that we did was think about how to break down the volume of this large space. We didn't want it to feel like an airport. So that's why you're seeing a series of rooms and moments, both for male and for female waiting. But in addition to that, we're offering our users a sense of choice, right? Because when you're waiting, do you want to just sit in the chair the whole time? Maybe you want to work on your laptop. Maybe you want to sit and read a newspaper. Maybe you want to find a space to have a private conversation with a loved one that you've traveled with. We want to make sure that we're providing choice in different types of space so that we can make sure that people have a more comfortable waiting experience. So we've spent some time talking about more public spaces. I want to spend a minute talking about the more private spaces like the patient room. So what's foremost on our minds as we're designing a patient room? Well, what you're not seeing in this beautiful rendering is the inevitable clutter that comes with any patient room, right? What's missing in this rendering are the IV poles and the respirators and all of the other nonsense that populates these spaces. Well, our first principle is do no harm. We want to be able to create a very calm, healing environment. So that's why you're seeing the introduction of natural materials or things that look like natural materials. We're also being considerate to providing a comfortable environment for the patient family. Maybe we give them a sleeper sofa so that they have a comfortable setting to spend the night with their loved one. Also thinking about flexible use of furniture. Maybe we specify things like ottomans that can be repurposed in many different ways so that the family has choice on how they want to be able to use the space. And we're also thinking about the caregiver area. So we've got a charting area that's sitting directly next to the patient bed on the side that you would enter into the room. And this is so that as the caregiver is coming in, they can do patient charting, still maintain a conversation with the patient, and then even after hours, still have open views to the patient, but at the periphery where they're not going to be disturbing them. So there's a lot of consideration that goes into designing even these small rooms. Since we're talking about caregivers, I want to spend some time really asking the question of why we keep designing nurse stations in a bullpen arrangement. We've been doing this for 40 years, but nurse stations work as a team-based unit. And designing them outward facing means that they're constantly facing away from each other. Keep wondering if there might be a better way of designing these types of spaces to create more of a team atmosphere. Also thinking about their respite spaces. We all know that they work very long hours under very stressful conditions, making sure that we're offering the same biophilic properties to our caregivers so when they have a moment of respite, they're really making the most out of it so that they can then return back to their day refreshed. Maybe this is a new approach to thinking about the workplaces for our caregivers. A gesture as simple as inverting that outward-facing bullpen and having our caregivers facing each other, having eye contact with each other, being more inclined to mentor each other, could certainly be improved. This also could be a more improved model for our secondary care providers, respiratory therapists, social workers, physicians that might be stopping by in the nurse station, maybe checking in at that teaming area for the moments that they need to be able to dialogue with the care team and then be on their way again. For the respite spaces, rather than focusing on the respite spaces being completely buried to the inside, how can we give our caregivers respite spaces that allow them access to daylighting and views or amenities like what we've provided on the first floor of our hospital building? And last but not least, thinking about the medical community at large. So this has been an inspiring 2 days, spending time with so many of you and learning new ideas and thoughts exchanged between us. It's important that we be thinking about the larger healthcare community as we're designing our medical spaces and continuing to underscore the importance as a global medical community that we have that opportunity to share ideas on how to improve the patient experience. So thank you very much. Shukran. I'll be seeing you in a few minutes.